This is the morning of the 13th of January, 2026. Clip on Exposing the Darkness by Linus of Judah Ministry, posted on the 12th of January. Title: A strange new horror. U.S. health official sounds alarm on Canada's assisted suicide organ pipeline. As Canada's MAID program becomes increasingly intertwined with organ donations, a senior HHS official warns the ethic guardrails may be failing. Didn't they fail during COVID? Huh? They will shoot you up with remdesivir that they know shuts down the kidneys. Body fills up with fluid. They can't breathe. They ventilate them. Then they, I think, harvest their organs. A senior U.S. health official is publicly condemning a development in Canada healthcare system that he says crosses a deeply unsettling ethical line. And doctors in America didn't cross that same line when they're vaccinating babies. In a recent interview, Deputy Secretary of Health and Human Services Jim O'Neill described Canada's growing reliance on organ donations from patients who die via medical assistance in dying. MAID is a strange new horror. The comments come as Canada reports some of its highest deceased donor rates in the world, driven in part by assisted death, prompting renewed scrutiny for U.S. policymakers as similar debates unfold south of the border. Only a matter of time before it's here everywhere. I think it's already available in certain states. Deputy Health and Human Services Secretary Jim O'Neill condemned Canada's permissive physician-assisted suicide program for ill patients, which he said has crossed ethical boundaries by increasing deceased organ donation rates. O'Neill, the second in command at HHS and acting head of the Center for Disease Control and Prevention, told the Washington Examiner in an exclusive interview that he was disturbed to learn that Canada's physician-assisted suicide program, operating under the label of medical aid in dying, has enabled it to become a world leader in organ transplant policy from deceased donors. It's just a business, folks. Demand from the millions of patients worldwide who need an organ transplant greatly outpaces supply, leaving organ donation policy ripe for perverse incentives. In the United States, an average of 13 people die every day waiting for an organ transplant. O'Neill and Health Resource and Service Administration Chief Thomas Eagle has said they are trying to revive trust in the American Organ Procurement and Transplantation Network after multiple troubled reports of organs nearly being harvested from live patients in several states, including Kentucky and New Jersey. But O'Neill said that Canada's program is uniquely problematic compared to even the most egregious stories in the U.S. We thought we'd seen all the possible horrors, in America, and then Canada had the strange new horror that was really just shocking, said O'Neill. The Canadian Medical Association Journal published a paper in 2024 outlining a substantial increase in deceased donations in Quebec during the first 5 years of the MAID program. In 2018 to 2022, the number of deceased donors who died by physician-assisted suicide increased from 4.9% in 2018 to 14% in 2022. A broader study at Canada, Belgium, and Netherlands and Spain, published in the American Journal of Transplantation in 2022, found that 286 people across 4 counties donated their organs after physician-assisted suicide. Nearly half of those donors, 136, came from Canada. But the number of organ donors is still relatively small compared to the nearly 16,500 Canadians who died by physician-assisted suicide in 2024. You know why? Because if they had cancer, their organs aren't harvested. The Canadian Health Service reported in November that roughly 60% of MAID recipients in 2024 had cancer, which in most Canadian provinces would preclude them from choosing to donate their organs upon death. The Canadian Institute for Health Information reported in 2024 that 62 Canadian donors donated their organs after physician-assisted suicide, accounting for 7% of the less than 900 total deceased donors across Canada. O'Neill said he has not spoken with the Canadian counterpart about the matter, but apparently the link between assisted suicide and organ donation rates in Canada is very unfortunate. In the U.S., 14 states have legalized physician-assisted suicide, most recently Illinois as of December. The growing adoption of physician-assisted suicide across the country has led some opponents of the practice to speculate on the U.S. will evolve in the same direction as Canada. Don't they sign a Hippocratic oath, shall do no harm? Yet they're killing people. State laws on physician-assisted suicide are much stricter than those in Canada, where the National Parliament next month will review whether patients suffering from mental illness can choose MAID. In Illinois and elsewhere in the U.S., 2 physicians or healthcare providers must certify that the patient has less than 6 months to live before choosing physician-assisted suicide. O'Neill, who says he has opposed physician-assisted suicide for his entire career, told the Washington Examiner, HHS will continue to pay attention to everything that touches or affects the supply of organs or the integrity or pressure that can be put on patients and families, including pressure to remove life support. There's so many factors and so many potential conflicts of interest that we are looking for ways to improve every single part of an organ donation, whether it's living donors or deceased donors, O'Neill said. Now, let's take a look at what happened during COVID. Well, somebody went to the hospital because they had a sniffle or runny nose. The hospital, after they did a test, the PCR test, which was totally worthless, they said, oh, you've got COVID. They put him into ICU, intensive care. They shoot him up with remdesivir. His body fills up with fluid. His lungs fill up with fluid. He can't breathe. They ventilate him. They have already taken his DNA. They know exactly what blood type he is. And I think they harvest their organs. That's why the families can never see them, even once they're dead. This isn't rocket science, folks. They were doing it during COVID, I believe. Tell me where you think I'm wrong. You can't, can you? And this is going to take place across America, just a matter of time. When I say this, I'm talking about physician-assisted suicide. You think not? Think what you like. I do.